All right, we are opening the floodgates into tonight's webinar. We'll get started in about 2 minutes here, folks. Get yourself comfortable. I'm gonna fan myself. I got my feather pen. It's hot. It's really hot. Oh man, I feel like we need some elevator music. If we could choose a song to open up this webinar, my esteemed panelists, what song would it be and why?
Oh man, that's a tough one. I can see clearly. I don't know who sings it. You know that I can see clearly now. It's a feel-good song.
I like it.
I think I'd pick Ice Ice Baby if it's too warm.
Exactly.
Sexual healing, very appropriate.
Yeah, I was thinking of Let's Get It On, some Marvin Gaye.
I think we need to propose that idea to SMSNA to open up our webinars with a song of choice. Maybe that's something leading up as we pick the song that gets the greatest number of votes.
I think that's, yeah, have a DJ and they can just like smash all of our favorite songs together.
That's what we need. Folks, for all of those of you who are joining on, if anyone has some DJ skills, we're looking for you. Send us a DM. All right, it is 7:02. What do you think, folks? Shall we get going?
Let's do it.
All right, let's do it. Let's do it. Good evening. Good evening, folks. My name is Amy Perlman. I'm a urologist. I specialize in men's health and sexual health in Iowa City, Iowa. My role for this evening is to MC this event. I'll start by introducing our esteemed panelists today. Throughout this 1 hour session, and I will keep it to 1 hour. If we find that towards the end, we're out of talking points and nobody's adding additional commentary in the chat box, we'll just end it early. Otherwise, I will end it at exactly the 1 hour mark. And I'll keep an eye on the chat box throughout tonight's webinar. If there's a question posed to a specific person who's not actively talking, then they are more than welcome to respond. But otherwise, I'll keep an eye on those questions, comments, grievances, and address them with our panelists. So let's get into the introductions. We have Elise Fosnight, Raise the Roof. She graduated from the University of Kentucky PA Studies program in 2011. She specializes in urology and sexual medicine. She is a nationally certified sexuality counselor and educator, as well as a nationally certified menopause practitioner. She is an active member and sits on several local, state, and national organizational boards. And in 2020, she opened up her own private practice, the Fosnight Center for Sexual Health in Asheville, North Carolina. If you haven't been to Asheville before, what an incredible place. And we're so excited that she opened up her own practice last year. Next up, we have Dr. Basil Kaki, is a urology PA at Baylor College of Medicine in the good old Houston, Texas Medical Center. He specializes in male and female sexual dysfunction, hormone replacement, infertility, and is engaged in clinical research trials focusing on shockwave therapy and potential treatments for hypoactive sexual desire in men. He has a particular interest in regenerative therapies for the treatment of erectile dysfunction and Peyronie's disease. And last, but certainly not least, we have Steve Carlson, a nurse practitioner and instructor of urology at Mayo Clinic in Rochester, Minnesota. He is part of the Men's Health Group and specializes in the evaluation and treatment of erectile dysfunction, Peyronie's disease, male infertility, and BPH. Clinic-based procedures and procedural education are some of his interests. Now, wow, I am so lucky to be a part of this panel tonight. And I think you can all see, by lieu of these introductions, why we have Elise and Basil and Stephen with us, because they are the cream of the crop, the epitome of superstars as advanced practice providers. So let's get an icebreaker going. Elise, you have an incredible bookshelf behind you. Tell me some of your favorite books and show them to the group.
Absolutely. Well, at the top of my list, I'm a little bit of an Emily Nagoski fan. So Come As You Are, for anybody who has not read it, it's on Audible. She has an incredible voice, just is an amazing sex educator. Talks a lot about female sexual health, but there's a lot of information in her book that you can pull over to the male patient as well. So totally highly recommend. The Penis book by Erin.
Really quick, Elise, is this recommended for patients too? Should we recommend that our patients? Okay, so everyone.
Absolutely, it's for everybody. She definitely geeks out with a little bit of science, talks about some research studies, but also keeps it very much on a very neutral level so that everybody can understand it. And a lot of times, you know, in my practice, I'll recommend that book to my patient and they'll come back. You know, obviously I do a lot of sex counseling. And so it's a great tool for us to kind of walk through it. She's actually got a lot of worksheets and a lot of homework assignments. So it's something that I can kind of keep my patients accountable. And I use it for a lot of my couples. Again, a lot of my guys can help to understand. She talks about accelerators and brakes when it comes to your sexual desire, and finding out what those are can be really, really beneficial for the couple and for the patient.
And then there was another book, and I interrupted you. Did you say the penis book?
Yeah, the Penis book by Erin Spitz is always a good one. Obviously, it's great for us as clinicians, but I find that a particular patient population can be benefit that as well. And then for those that are seeing patients with pelvic pain, a PT, Susan Gronsky, wrote the book Pelvic Pain, The Ultimate Cock Block. And it's a fabulous one too, talking a lot about prostatitis, hypertonic pelvic floors. So it's awesome also.
Awesome. And I'll add one to that list, Facing Pelvic Pain, which was recently put out, available on Amazon, written by specialists all over the world, talking about, you know, various aspects of pelvic pain. Any additions, Stephen, Basil?
I think you hit a lot of the good ones. I know the penis book and the eggplant cover is a popular one amongst our group.
Yeah, I agree with Stephen on that. Thank you.
Awesome. If anybody else on this webinar has any other recommendations for books, go ahead and put them in that chat box. We'll keep an eye on that. There is a page on SMSNA where we can actually add books that people recommend underneath the resources. So feel free to add in that chat box. So we're going to get into, you know, what it means to be a superstar tonight, but we have to go back to the beginning days. So let's think back to you finished getting your degree as an advanced practice provider. What did that initial job look like? What was your role? What were some of your challenges? Elise, why don't we start with you?
Absolutely. So what I researched in PA school was actually on female sexual health, and realized a lot of my articles were coming from urology journals. So the whole time that I was on my clinicals, I was really focused on women's sexual health, but I had actually worked with a urologist when I was in high school. And he caught wind of my love for female urology, female sexual health, and he said, do you want to come back home and work with me and focus on the female aspect of it, and I'll focus on the male aspect? And I was like, absolutely, who would want to pass this up? Like, my dream job right out of the gates. So at that time, his practice was about 85% men. So I got to learn love those penises and prostates too, which I think really benefits me as again, urology PA, but as a sexual medicine practitioner too, that does sex counseling and education. And so, gosh, I've been doing urology for the past 10 years, got into really the meat of sexual medicine about 8 years ago when I finished the postgraduate certificate program at the University of Michigan, getting my sex counseling certificate in education.
Awesome. So a lot of your training was in female. You were asked to join a practice that was largely male. And that was, so right after training, you got into sexual medicine. Steve, how about you?
So I finished with my family NP degree from Rush in the end of 2013, and was fairly determined to get a job in pediatrics or internal medicine. Prior to that, I had worked in general and colorectal surgery and saw a lot of urology patients. So I really liked the idea of urology, and I had a lot of good surgical experience, wound care experience, and I also did all the training to become a wound ostomy incontinence nurse. And this urology position opens up. I'm like, this would be a go-to, and I should look into that job. And that's where I started. It was in urologic oncology, primarily did kidney and testicular cancer. And in the first year I was there, Landon Trost was getting his practice up and running because he had returned after fellowship. And within that first year, he kind of sent a general email out to the entire advanced practice group and said, does anyone have any interest in being involved with men's health? And I'm like, why would I not have interest in this? This would be a fun area to work in. They would round up some of the testis cancer guys that I had already been meeting. I knew that they did some procedures. Trost and Josh Savage seemed to be like great teachers that already had good experience. And fortunately, they kind of welcomed me in the group and are like, all right, we can make this work. So I did half and half for a number of years. And as time has evolved, I do full-time men's health now, with the exception of the, elevated PSA and new renal mass consults and stuff like that. But most of my day is either men's health related procedures or men's health evaluations, with a good, strong surgical background in nursing before I got into it. Thought I would be in primary care, but to be honest, very glad kind of got reeled back into urology, because I can't imagine a more fun place to want to work.
Yeah, so you've had a potpourri, shall we say, of various experiences, and initially with interest in peds and internal medicine. Interesting. I learned something new here. Basil, how about you, buddy?
Thank you, Amy. So actually, I'll be honest, up until 3 years ago, I didn't even know that the field of sexual medicine existed. So I graduated in 2013. My first job was in the Harris County Jail treating the inmates. It was a 11,000 population facility, and we were actually told that we could not treat any kind of sexual function or any complaints. I accepted that position temporarily. It was only 3 months while I was credentialing for my full-time job in the ER. So I worked for 5 years at a level 1 trauma center here in Houston. Very high volume, about 100 beds. We had 15 APPs at the time that I started. And that was a great place for me to get my feet wet, see patients, learn procedures. And I really enjoyed it. But after 5 years of, oftentimes our waiting rooms had 100 people in them waiting for 24 hours. After 5 years, only 2 PAs were left of the 15 that started. And so a lot of us burnt out, and we had resigned. So I resigned, and my wife and I, we backpacked in Southeast Asia for 6 months. We had small backpacks. We started in Thailand. We went to Vietnam, Cambodia, Indonesia, Japan. And towards the end of my trip, I was in Papua New Guinea. And one of the PAs I used to work with in the ER was a urology PA with over 20 years of experience. And he had told me about a position that had opened up. And this guy, you might know him, his name is Mohit Kara, was interviewing. I didn't know who Dr. Kara was at the time. So we had our interview, and I was on a remote island with limited electricity. And the rest is history. It's been a great ride since then.
Well, you say the rest is history, but I want to get into a little bit more detail there, because you touch on you starting out your initial urology experience with a true superstar in the field. Were you intimidated? And how did you prepare leading up until the time where you were going to work with the world-renowned Dr. Kara?
Yeah, great question. So actually, when I found the name Mohit Kara, the person who was interviewing me, the first thing I did was go onto Google and search his name. And, hundreds of publications came up, and I was like, whoa, this isn't just any physician. This is someone special. So we had our interview, and I didn't have any formal attire at the time. I had a much bigger beard. And I remember one thing, I'll never forget it. He had me hooked. He said, I'm looking for a partner. He never had a full-time PA, but he said, I'm looking for a partner to grow my practice with. And he told me the things that were important to him. He told me about family values, but he also expressed the importance of hard work and how important his patient population was. So those things really stuck with me. So I told him I need 2 more months to finish up my trip. I still had to go to Japan, and my wife's a big sushi lover. So if I didn't go to Japan, she would have killed me. So in that 2 months, I tried to read every publication I could. I started ordering ebooks online, and I wanted to come in to impress him. I wanted to come in knowing at least a strong foundation, because he took a big risk. He interviewed people in person, but he never met me other through FaceTime, just as we're doing today. So I didn't want to let him down, and I just had a good feeling about it.
You bring up some very great points there. And one is that when you started working with, one of the real fathers of andrology and sexual health, is you had no urology experience coming in, but you took the initiative to read whatever you could. I think that's an incredible message for the folks who are tuning in tonight. We know that APPs play a critical role in urology and in sexual medicine. And yet during training, it really plays no role in anyone's training. It barely plays a role in the urologist training. But that creates an opportunity. I mean, the resources are out there. So for those folks who are interested in learning more and gaining that experience, I guess what I'm hearing from you is you don't need to be in a clinic to get the experience and expertise. You can do a lot of reading of research and books. And now there's so much webinar information out there that for people who are really interested, I think they might be at an advantage if they take those opportunities.
Absolutely, I agree. And I think that's why we're seeing a lot more patients in clinic, because this information is readily available and men are coming in and they're having concerns. You know, is there something you can do about my Peyronie's, about my low testosterone? And, you know, the average life expectancy is only growing. So our field is only going to grow, and patients want better quality of life for in their later years of life. And I love that we can offer that.
Awesome. Now, to touch a little bit more, Basil, and then I'll give you a break here. I'm putting you on the spot. You know, your work going from sort of 0 to 100 with urology and taking in as much information as you could is part of what makes you a superstar in urology and your ability to take on that initiative. Now, during our prep call the other day, you discussed the importance of mentorship, and you mentioned that was one of the reasons why you were interested in working with Dr. Kira. Talk to us about the 3 A's of mentorship.
Yeah, no, thank you. So as a PA, you know, you always dream, you hope to have a partnership with a physician that respects your education, that fosters and nurtures your growth. So that's everything Dr. Kara is, and I'm always trying to improve on everything I do. You know, I was a former athlete, and even after 15 years of experience, there's, you know, you look at Michael Phelps, for example, he's always trying to get better. There are always things you can improve on. So 2 months ago, I approached Dr. Kara and I was wondering, how did he become so successful? And he told me about the 3 A's, and I started looking into the 3 A's. So the first one is going to be availability. The second one is affability. And the third one is ability. So it all starts with, you know, patient calls to make a clinic. Is that provider available to see, or is it going to take them 2 months to see that that provider? And then when they come to the clinic, how long are their wait times? So Dr. Kara has always been available. He really does lead by example. Even if he has a 50 to 60 day clinic, anybody that approaches him with a question, whether it's myself, an MA, or a patient, he's going to stop and give them their undivided attention no matter what day it is. So it's very cool to see that. So the second A is going to be affability or likability. And especially in our field, you know, many of the subjects we talk about in clinic are very intimate. You know, patients aren't just going to open up to anybody or gain trust in anybody. So being likable, you know, truly engaging the patient and being, you know, genuinely interested in their concerns makes a big, big difference. I think the easiest one is the third A, which is ability. Are you a competent provider? You know, you can have 2 of the 3. You can be competent and you can be available, but if you're a jerk, no one's going to want to talk to you. No one's going to put their trust in you. I mean, these are very intimate subjects. So again, very fortunate to have a mentor like Dr. Kara, you know, yeah, that's it.
Awesome. Steve, we're going to bring it to you next, because part of that mentorship and learning the expertise to have those abilities, I think that's what makes you a superstar at Mayo and in sexual medicine. The procedures that you do are perhaps procedures that even urologists, you know, oftentimes don't do. So talk to us about what makes you a superstar in terms of your ability to be really autonomous with office-based procedures, and how did you develop those abilities?
I appreciate the kind words, Dr. Perlman. You know, our department head is one of the best surgeons I've ever met in my life. He's one of the most talented cancer surgeons. And when I started talking to him about my progress in learning vasectomy and being independent with it and getting into the hundreds of procedures and teaching other residents, he would shake his head and say, I would rather sterilize a man by removing his bladder and prostate, and it would probably take me less time. And he just remembers having the worst experience in training. And I find it amazing that I think I'm fairly straightforward and don't think I'm super talented, but someone who I think you would be hard pressed to find 5 people in the world will be more talented, would struggle with something that I do every day. You know, kind of puts things into perspective. But you know, when I think about, you know, what has caused me to go along a transition of not not knowing how to put in sutures, to be able to try to teach residents and fellows how to do things that they're uncomfortable with. I think it started with taking advantage of situations. Is there availability to do something, or do I have to try to create that availability? Are you going to the people that you want to look up to and that you respect to say, hey, would it be possible for me to learn more about what you do in your clinic? How can I be more involved? For example, when the topic a few years ago came up, is anyone in the group interested in cystoscopy? The first thing I thought of was, I have to make sure I know all the ins and outs of all the AUI guidelines for urothelial cancer. I have to know what to look for. Where's the Sugarman's book? How do I order this? Can I look at someone's before mine gets here? To try to be as prepared as I possibly could. And when I think about where has it evolved along the continuum, between Drs. Kohler and Trost and Josh Savage teaching me things over the years, at times you feel uncomfortable. And I remember the first test appel I did, I remember just being very nervous, and Josh Savage made it kind of just push me, you're going to do it. And that's just the way it is. And it turned out just fine. I was perfectly capable of doing it. I had seen it. I had practiced a couple of times with supervision, and it was fine. And so I try to think of, yes, you will always be in some situations that make you uncomfortable, but you need to just plan about it and try to create a good safety net. Try to create resources so that if you run into a roadblock, a little bump in the road, is there someone in here that could, maybe come in and blend in if there's an issue? And as you do more and more, you start to see the same things over and over again, and you can learn how to deal with, a vessel that won't stop bleeding, or I can't get this vase back down properly, it's stuck on Dartos. Little things that will hang you up in the beginning that you learn to just avoid or solve very quickly. And then you can teach other people how to do it. So it's been a long continuum, but it's a constant evolution. It's always learning and taking advantage of opportunities and trying to pick up on cues from the people that you perceive as the pros.
Yeah, and you really emphasize a lot of the points that Basil made, which was you came prepared. So before, you expect to be able to do a procedure, you read the books and you know what you're looking for. And then you said yes to any of those opportunities that came about. Now, this next question I'm going to open up actually to all three of you. What if those opportunities aren't available? What if someone is not fortunate enough to work with the mentors that, each of you have had to say, I'm looking for someone to do these procedures? What are some other ways that people can learn these skills? Or are those kind of far and few between?
So go ahead, Basil. Yeah.
No, go on, ladies.
One of the ways that I really looked for outside opportunities. So my physician, Dr. Barry Body, was the urologist that I had worked with right out of the gate. And he was always so supportive, and he encouraged me all the time. Elise, what do you want to do? What are you passionate about? I know that sexual medicine is it. What can I help find you different resources? I'm here, and yeah, it's kind of within my scope of practice, but I recognize that I may not have the background that you're looking for. So obviously having that relationship with the physician that you're working with is super key, because they know people, right? They know people all over the country too. So he definitely was able to hook me up with some, so for instance, I deal with a lot of trans non-binary folks. So if we were doing some surgeries or surgical interventions or hormone therapy, that wasn't kind of what he was really interested in, but he had a colleague that he worked with back in Louisiana. So he hooked me up with them. Becoming members of SMSNA and ISWISH and ASECT, which is the American Association of Sexuality Educators, Counselors, and Therapists. They have resources all over the place. And when I would go to conferences, if somebody was doing a presentation on, trigger point injections or, Botox in the pelvic floor, I went up to them immediately afterwards and said, where did you get your training? What are the resources? What are the things that I can look at? Are you available for one-on-one? What kind of mentorship, programs do you offer? How can I, get that training? And so it's just being able to look outside. I feel like a lot of times with APPs, we get so focused and we have to only, practice within the scope of our supervising physicians or our collaborating physicians. But they do have the tools to do some of these things, and they have the understanding and concept, even though they may not want to do it. I know a lot of urologists that I have worked with, I'm the one who does Xiaflex. They may know how to do it, but they've never, maybe they've done one, and I've done, almost 100. So, I mean, thinking about those things and thinking outside the box, that you don't necessarily always have to be right there within the box of your supervising physician, collaborating physician. It's being able to reach out to other colleagues, other providers, especially to say, hey, I have another, PA colleague of mine in Boston that's doing X, Y, and Z. I'm really interested in doing this. How can we make this happen at our clinic?
Yeah, and you bring up some really great points there in terms of learning skills that might be not something that an MD offers. I think that even makes one even more valuable. Like if someone were to join my practice and before I started here, I'd never done XIAFLEX before for Peyronie's. So if I had started here and was working with an advanced practice provider that said, oh, I'll see all those patients, I'll do all the XIAFLEX, I would have been like, that's amazing. Thank you. You can do it. So there's so much value to both offering skills that your supervising provider, knows how to do, but perhaps even more so knowing the things that others don't, because that helps you develop your own niche. Basil, did you want to add something?
Yeah, you guys really just took the words out of my mouth. But I think, as APPs, we shouldn't underestimate what we, utilize each other better. We have people like Stephen and Josh who are, very advanced in their procedures. And, if we want to, we can travel to other parts of the country and spend a week or so just practicing with other APPs, because you're right, some PAs or nurse practitioners are in rural areas and they don't have access to a urologist or urology specialist. So having an APP who's available to be seen and help, I think is tremendous.
Yeah, I'll finish like my Wednesday clinics. And if I'm training a PA in my clinic, I'll kind of do a little spin and I'll say, all of this could be yours. And most people are like, no, I don't want it. I don't want it. But the reality is pretty much every patient and everything I do in the office in sexual medicine and men's health can be done by a well-trained advanced practice provider. And so I think the key for a lot of folks, if you're interested in getting hands-on experience and having autonomy, is to find the good mentors. So let's talk a little bit about that. When people are interviewing for jobs, what are the questions that people should be asking to help identify those mentors that will allow them to work at their highest level of licensure? And Elise, why don't we start with you on this one?
Yeah, absolutely. Those are, I precept a lot of PA students, and that's the question that comes up a lot is, how do I know I'm going to get that right fit with that right physician to be my mentor, to help me, out with it. So, one of the questions that I always encourage them to ask is, when I'm wanting to learn something new, or I have an interest in something, what are the ways that we're going to be able to work together to help me achieve that? And if they aren't encouraging and saying, let's find resources, or let's work on this together, and I want to send you for this training, all this, if they're just like, nope, I just want you to see patients in the clinic, if they're not going to be supportive of what your goals and dreams are and how you see your career advancing, you might have to find somebody else. And that's okay. I think a lot of times too with APPs, we get really excited when we get an interview and we want to jump on it. But, if it really is not feeling good in your gut, in your heart, in your soul, it's okay to say no. There will be an opportunity that will come up, and somebody will be out there that's willing to provide you those resources, guide you, help you through that process. But, that's a really good question of, how are we going to be able to work together to help me achieve that goal? So that's one of the questions I encourage them to ask.
Awesome. And I love that, identifying conferences where people can go out and network. I mean, ultimately, when I train advanced practice providers, I want them to network with other advanced practice providers who are leaders in the field so they can network. And I might be asking them questions that I just don't know, and so helping them and supporting their own development of their network. Basil, anything you want to add there in terms of like, what questions did you ask, Dr. Kira, or did he just glow that information that he was going to be a good mentor?
Yeah, I mean, the glow is very correct. So I got a really good feeling just from talking to him. I think that I expressed some of my concerns about, I'm very family oriented and I have a lot of extracurriculars outside of work. And he put those concerns at ease right away and says, when we're at work, we work hard, but when we're done, we'll be done at a reasonable time. So I think just using your gestalt to make that decision is very important, like Elise said. And if you don't get a good feeling, that's not a position you have to accept, nor a position you have to stay in. We are very thankful to have physicians like yourself, Dr. Perlman, who are, advocate for PAs, but there, unfortunately, sometimes you don't get that. So your first job won't necessarily be your last job, and you can always, find the right fit. And honestly, you might not know your right fit as a starting PA, because you might not know what you want to do or what kind of procedures you want to do. So that might take some time to develop, but it's always something to think about.
Mm-hmm. And then Steve, you've worked with incredible mentors. How did you get that vibe? What questions did you ask?
Yeah, and I think you guys have echoed a lot of really important things. And I think when you're new, I think it's kind of hard to imagine exactly what would my role be in this subspecialty. And I agree. When I interviewed, my focus was, okay, this is an oncology position, it's oncology and general urology. Didn't really have procedures on my radar, nor did I know that it was even going to be an option. And I think that as time evolved, that question of, well, where do you see yourself in 5 years? I think you can re-ask that and inflect in it a lot and say, well, I really want to be more involved with national and international organizations. I want to be more involved with presentations. I want to learn more from the people who are outside my immediate safety net to figure out, hey, what are people doing outside of Rochester, Minnesota? And I think trying to evaluate what their support is. And I think that you're going to find polarizing ends. You're going to find one end, like our group, which I'm very fortunate to work with in Rochester, that's very encouraging, wants everyone in the group, not just Men's Health, all the advanced practice providers, to explore, to develop their interest, to have access to learning new things. And then you can go from the opposite end of the spectrum, and you could work with someone who says, I see all the kidney tumors and bladder tumors and prostate cancer, and you see all the chronic urinary tract infections and chronic prostatitis. Anything that doesn't need surgery, you get, and all the meat and potatoes I get. And I think it's finding something that you're happy with. And I think that different providers have different perspectives. I've met a lot of my friends and colleagues who are APPs, and they just say, I'm not really interested in doing procedures. I don't want to do injections. I don't want to do endoscopy. There's nothing wrong with that. It's just finding a good mix where you can feel like you're contributing to patient outcomes, when you feel like what you did was productive that day, you felt like you helped people. But I think a big part of it is getting a good connection with that person that you're interviewing and making sure that they're supportive of what your interests are and truly thinking about what your interests are, instead of just doing the general, like, oh, well, I just hope I have a job in 5 years, or, maybe I'll get an extra week of vacation or something like that. Really think of, where do I see myself professionally, as opposed to where am I just day to day?
Yeah. I think as I've been interviewing some applicants for APP positions, and I think it's just a really hard time right now, because I know as a physician that one of the big answers to me not burning out is having a great integrated team that comprises advanced practice providers. And so we hear all the time, we need APPs, and yet, there aren't that many positions that are hiring. And so, I see a lot of applicants that they're looking for a job, and I'm trying to figure out, would they be happy in urology? And Steve, you touched on this. I mean, even within urology, I think people are always surprised when they do their rotations, whether they're medical students or, or residents or PA students, NP students, is that there's so much breadth within urology. And even though we're all seeing the mutual patient, the patient with prostate cancer also has kidney stones, will also have erectile dysfunction, and we're probably seeing him for that third reason. He's all the same one, but the conversations are very different. The stone conversation is different than the prostate cancer conversation, than the ED conversation. So how do you tease out early on in your career, what do you want to talk about? And what is your recommendation for the new folks on the call when they're just looking for a job and they're trying to figure out, what do I want to talk about on a daily basis? How do they figure that out?
If I can jump in here, I would say the easiest way to do it is to just jump in, jump into the deep end of the water, right? You want to experience everything and don't say no to anything initially. And then after maybe a year to 2 years, you can decide, okay, this is actually my clinical interest. I'm interested in doing Peyronie's disease or in studying ED. And then these things are dynamic. I mean, they're going to change. So Dr. Karen and I, we sit down at least once every 6 months and talk about some of our goals. Like, what do you want to accomplish by the end of this year? Where are we headed within 6 months? And these things keep us driven. We have goals that we like to attain together and separately. And, obviously he's helping me the majority of the time, but things will change, but you have to be open to change. my coach used to tell me resisting change is like holding your breath. So I'll let you guys think about that a little bit. So
what sport were you in?
yeah, so I was a swimmer. I swam. I started swimming at the age of 3 or 4. I had my first national record at 5 years old, and I competed all the way through college, and I was on the Olympic team in 2008. So my whole life has been really about optimizing my own, health, wellness. So it was a very seamless transition because, as you all know, the foundational aspects to a lot of our treatment plans for ED, hypogonadism, are going to be lifestyle modifications. You've heard of the importance of exercise, stress reduction, sleep, and diet. So that was something I did my whole life. So talking to patients about that is something, so easy for me, as it is for you guys.
Awesome. And that's part of, we rarely sit down. I'm so happy to hear. And that's a really good piece of advice that you sit down with your mentor, on a regular basis to discuss your individual goals and your goals together, which I think so rarely happens. And I just wonder what it would look like to get the whole team together. You get the MA together, the nurse together, the advanced practice provider, the MD, and you say, what is each of our roles in caring for this one patient? What do you say? What do you say? What do you say? What do you do? And maybe one of those roles is for the medical assistant when they're going through all their medications and they say, okay, metoprolol, do you still take that? Okay, Viagra, do you still take that? And the patient says, oh yeah, but it doesn't work. That is a door that just opened. But that medical assistant may not know that that's an open door for that person to say, oh my God, yeah, we have so many different resources. Why don't you, check out front and schedule an appointment with Steve? Or we have a sexual medicine clinic. They'd be thrilled to see you. So it's understanding, I think, in each of those scenarios, what are those open doors, and who is going to be having those lifestyle modifications? Who does it make sense to have that conversation? Is it the surgeon? Is it the advanced practice provider? Is it the nurse? I'll tell you, when I finished my clinic yesterday, and I'm kind of like, I was like, shit, I was so cold in my place last night with a blanket on. And I think part of it was I was just so exhausted from clinic. And when I was thinking about why I was so exhausted, it was because I was having nuanced conversations about nutrition and exercise with every single patient that day, and sending them for sleep studies and giving them medications and talking about surgery. And that was physically exhausting, putting me like in fetal position. And I think the answer to that is, who else can we train to have those conversations? And that's the beautiful part of having advanced practice providers and MAs and nurses. But that point that you made of like, what would it take for us all to sit down to say, what is your role? What is your role? What is your role? What do you want to do? What do you want to talk about? What makes you happy? And just, I would love to see that happen. Now, Elise, you have your own center. So you mentor a lot of people, you call the shots. What did it take? What was the mindset? What was going on in your mind to make that transition to say, I'm doing this, let's go balls to the wall?
Yeah, absolutely. So you can ask my mom from a very early age. If somebody told me I couldn't do something, I was going to prove them wrong. Like that was just always the way it's going to be. And like we've all talked about here, right? We always, what is that next step to better ourselves? We're never plateauing, we're always growing. And so I had a patient who I put into my penile rehab program. He had prostate cancer, had a radical prostatectomy. We were trying to maximize erectile function and minimize his incontinence. And so after about a year of being in my program, he was having spontaneous erections, very minimal incontinence at that time, was a race car driver, and was just so excited that he didn't have to wear his Depends during a race. And so he just kept following me up for his routine PSAs. And we got to having a conversation, and he said, I know you love, sexual medicine. What do you want to do? And I was like, oh, I would love to have this interdisciplinary center where we have the biopsychosocial model and, the medical piece and the PT and, sex therapy and just the whole 9 yards. And I was like, I am too young. I'm too early on in my career. And he was like, absolutely not. He was a business guy, said, give me a business plan. So I was like, okay, this is great. And I had actually first approached my hospital institution and said, I really want to do this. There's nothing like this in the area. Having a sexual medicine clinic, here's kind of, the layout of how I envision this, how can we make this happen? And unfortunately, at that time, they said, we just don't see the value in this. And I was like, oh, you have no idea what you're turning down at this point. And so, so someone told me no. And I was like, okay, how am I going to make this happen? So, I wasn't taught how to write a business plan. I Googled, just like any other person, how do I do this? And I was very fortunate at the time. So I'm on the board for the North Carolina Association for PAs, and they had a master's student at one point put together like how to do a business plan and how do you open your own practice, because we have that capability here in North Carolina. And so it was a good starting point, but I knew I needed a little bit more. So I actually took a business class. I was the first one in healthcare to actually come to one of those business classes. I got a business coach. I really tried to really take a whole different lens on it. And I found those resources. I actually had another PA colleague of mine who was opening up her own practice in Michigan. So we constantly were going back and forth and trying to bounce ideas off of one another. And how do you do this in Michigan? Or how do you do this in North Carolina? And what are your plans for this? How are you implementing this? How are you paying that person? Right? There's no guidelines to this. So essentially we were taking bits and pieces of how other people were opening up their own clinics or their own practices, and just kind of putting our own spin to it. I've always been the one to, if there's not a path, I'm going to make one. And so, that was just how kind of this all unfolded. The business plan has been through like 80 different editions at this point, to the point where me opening up a larger practice is actually happening about 3 years earlier than what I thought it was going to. So we're moving to a bigger location the end of this year. I've only been open for a year at this point. A year tomorrow. I am so excited. We're having a big celebration. I'm going to start crying because I'm so grateful for all the support. And that was the other thing too. I surrounded myself with people that believed in me, but kept it realistic and not questioned in a negative way, but questioned in a, I want to see you succeed. Is what you're doing going to be beneficial? Is that something that's going to bring value to your clinic? Putting that business hat, so not only value to the patient, but monetary value that is going to sustain itself. So we have just done extremely well. And it's making sure that, again, you have that staff that is knowledgeable, right? We were just talking about too, being educated. Your whole staff has to be educated, right? The person who picks up the phone, again, I see a lot of trans folks. So making sure that they understand what pronouns do you want to use? What kind of hormone therapy are you wanting? We are, trauma informed and LGBTQIA friendly. It's just having those staff and having that education. We sit down with, we have a monthly staff meeting, and we talk about goals for the business, but we also have a topic for that meeting, because I want everybody to know what's going on when a patient comes in and they're looking for ED treatments or Peyronie's, so that everybody knows and has that information, because it's not just me that's educating the patient, it's everybody, because that patient may ask your MA a question or your front staff, or like my billing person who answered the phone the other day and had like a 30-minute conversation with a gentleman about his erections. And she was like, never did I ever think that I would do that. Right. So it's, it's the whole team that really benefits and makes a difference in that patient.
Yeah. And we think about, all the interactions that our patients have with various members of our team. They probably have the least amount of interaction with each of us on this call. And so all of those other interactions, my secretary has these, this one guy keeps calling in, talk to Perlman, see how I can get better orgasms, and my poor secretary, I'm like, I don't really want to call that guy back. But yeah, every member is so critical, or especially like when I wanted to bring in XIAFLEX, there's a lot of paperwork. We all know that the infrastructure has to be in place to make that successful. So I sat my whole team down, from the billing people and the scheduling people and my nurse coordinator and my secretary, and I educated them on Peyronie's, and I said, this is the why. This is why I'm asking you to do more work here, because this will benefit a lot of patients. And if they don't understand the why and the disease process and why patients want it and who does well, then they don't understand why we're asking them to do more work, or they have, they're kind of angry or frustrated about that. So I love that you have those regular meetings, on a monthly basis. So from the time that you put the boots to the ground and were really pushing forward with your idea to open up your own clinic, what does that timeline look like? Is that months? Is it years?
I would tell everybody, give yourself a good 6 months to really sit down and focus. What are your goals? What is your mission? What is the overarching theme that you want your practice to be, right? So for me, it actually took about 3 years. We knew we wanted to finish up having our family. So I have 3 girls, 6, 4, and 2. And it's funny because I actually, on my last maternity leave, took my littlest one around looking for clinic spaces. And like, I met the contractor as I'm nursing her, like in the middle of this room. And, so it was just like, you just go and you just do, and you don't worry about it. And so, it's just integrating. I mean, I had, my girls there with me during construction, and they were so excited. And, so it's just like, it's a big family. Like, I recognized too that it wasn't just me that was opening up the clinic, it's my whole family that's doing it. We had to make a lot of changes. So, looking at who your support people are going to be for that. And, getting a business coach, we refinanced the house. Trying to get a business loan was tricky, right? Because I had all this clinical experience, but I didn't have the business experience. And so how are people going to lend me money to open up this business if they don't know my business hat? Sure, maybe I'm a great provider, but how do I know that you're going to be very critical and thoughtful when it comes to your finances? So that was really tricky to find that. And I went through several banks, and finally I said, we're going to just refinance, the house. I wanted to do it kind of on my own. So again, those are the types of things to think about. How are you going to finance it? It's going to be the biggest thing. You got to think about insurance. You got to think about liability. You've got to think about, the sanitation and the sterilization. Are you going to have an autoclave? What's your supplies going to look like? What's your monthly overhead? What do your salaries look like? There is just, I know, right? There's so many layers to it. And people just think like, I'm just going to open up my own practice. But if you really want to be super methodical and strategic about what you want to do, you've got to take that time. And again, having those support people around you, and not just during the planning period, but as you go through this. We know that businesses, that first year is so critical in success. Having a marketing business idea. I had a marketing guy, that was graduating, and he needed an internship. So again, that's the other thing too. How can you get people to do things for you for free was the other thing. And so he was doing his internship. And so we were able to work out kind of this deal to be able to market, and where do you want to put your money, and looking at the area, who's your competition. Who do you really want to work with? How are you going to get that information out there so that people know you're there? How are they going to get your referrals? What phone system do you want to use? What kind of fax? I mean, it's hysterical of how many of these things I didn't think about before. And I'm always learning. I'm always growing. I have staff with me too that have a little bit of business background, but I've sent them to business classes too and said, hey, you want to learn this? So, it's really interesting how, we've talked a lot about who is your collaborating supervising physician, and how is that mentor going to help support you? But I'm flipping the script here a little bit, and how do I help mentor my staff so that I can make sure that we are the best that we can be by everybody supporting. I tried to, at the beginning, to do it all. I spent 4 hours on a Saturday with my mom, who has background in billing and coding, to try to figure out these claims and why they weren't going through. We got through 4 claims in 4 hours. It was ridiculous. I hired a billing coding person. She got through 100 of the claims that were pending in an hour. So you've got to figure out who do you need on your team that knows what to do, because you can't do it all. You can oversee it and that sort of thing. But that was the biggest thing for me too, is letting go and allowing people to help me. Because my name's on this business. It's the SMSNA Center. So making sure that it wasn't easy giving that up. But I still consult with her, and she knows how controlling I am. So she comes to me all the time and is like, I'm just letting you know we're doing this, Elise. We're moving forward. Is that okay? Do you want to do this? But it's really taken a lot of that weight off me. So I can, again, focus back on patient care, educating my staff, and again, promoting our profession.
Awesome. So let's get into what does a typical day look like? And I want to know this from the time you wake up. What time is that? what does your morning look like? What types of patients are you seeing? How many procedures are you doing in a day? What time are you finishing? And I know everyone's schedule looks a little bit different, but I want to give those who are on this webinar tonight a little taste of what it looks like on a day-to-day basis to be a superstar APP. Basil, let's start with you.
Thank you, Amy. It's such a privilege to be on this call with Elise and Steve, and just hearing their passion and the things they do is inspiring. I mean, congratulations, Elise, on growing. That's not surprising. You can definitely hear every time you talk about the FOSS Night Center, I get excited. I want to be a patient at your clinic. My gosh, it's amazing. So my day starts, I wake up at 6. I spend 5 to 10 minutes in prayer every morning, just praying, and then on my way to work, I commute for about 45 minutes. So I listen to podcasts or an audiobook or some kind of urology ground rounds. I get to work early. I'm probably the first one there. I get there around 7 o'clock, and I spend about an hour replying to patients. We have a MyChart system, so that's something of availability. I try to respond to everyone within 12 hours if I can. So I do all my own responses. My clinics start at 8. Dr. Kara and I, we each have our own clinics, but we intentionally had our clinic days overlap. This way, if I can help him, great. If he can help me, great. So we have a really good team atmosphere. My clinic runs from 8 to around 4, sometimes a little longer till 5. I like to see between 15 and 25 patients a day. I have 2 half days, and that's Wednesdays and Fridays, but typically my clinic is done at 5. I get home, and then I turn into super dad mode and play with my son. We go swimming, we go on a walk, we go bike riding. I disconnect from everything. I put my phone on airplane mode and don't look at anything. The son goes to bed around 8. Some days I'll go to the gym afterwards. Other days I'll just spend some time, and decompress, hang out with the wife, watch movies, eat some snacks. And usually I'm in bed by around 10 o'clock and just we repeat.
Awesome. Wow. I mean, that sounds like a real banner day. I'm feeling that. Steve, you're up next.
I usually get up between 5:30 and 6, and I'm exhausted. It's get the kids ready, brush teeth, who's going where, get everyone in the car. I usually go to work with my wife, so we're all in the car together. Older ones go to school. The younger one goes to his daycare / school place. I try to get to work about 7:30 or so, and I start trying to look at what's going on that day. So it's either going to be I'm on my own, which can either be clinic, procedures, or a hodgepodge potpourri mix, or I cover one of the 3 men's health surgeons in their clinic. If I'm on my own, I am on my own. I am by myself. I don't get a nurse. I don't get anyone to work with me. If I'm lucky, they'll give me a second room so I can bounce back and forth, but usually we don't because rooms are so tight. And sometimes it's a mix. You just try to go as quickly as you can. I try to get a brief overview of these patients before I go in, so I look remotely intelligent when I walk in the door, knowing their history. And then you just pound through the day as quick as you can. If I'm waiting for a patient to go in, I'm looking at the in basket because it's always growing. And try to knock out things here and there to cut down on the load at the end of the day, eat a little bit for lunch, and then rock it out in the afternoon. So sometimes it's a full clinic day, sometimes it's a morning clinic afternoon procedure, sometimes it's a full procedure day, and sometimes it's a potpourri of whatever comes in the door. Try to wrap things up in clinic around 3:30 and then spend the next hour or hour and a half at the in basket, prescriptions, faxing stuff, other things, whoever calls a meeting, stuff like that. And I try to wrap it up and be out of there by about 5 or whenever my wife tells me to. And then it's, get in the car and get these kids picked up, figure out what we're eating. I am not as great of a parent as Basil and Elise because my kids stay up late. And I do that because I feel like I don't have a lot of time with them in the morning, and I want to have time with them in the evening. So they're usually not in bed until about 9 or so. But I try to let them sleep in, on the days that my wife doesn't work or on the weekends. I shut my pager off at the end of the day. I don't take it home. I don't take call. I don't work nights. I don't work weekends. Thank you, all of the residents at Mayo Clinic. You do a fantastic job, so I don't have to. I try very hard to leave work at work. I try to not irritate my wife by talking about clinical scenarios at home, and I will fix any lingering issues the next day when I get there. It'll still be there. And so I think that is important to leave, like Basil said, disconnect, because you need to focus on things that are truly the most important in your life. And right now it's my family. And I need to get better at it, but it's improved over the years. So, and I try to get to bed by 10 to 11 and then rinse, repeat for the next day. And on the weekends, I'm teaching my kids how to fix stuff. I'm trying to get them outside. Maybe the washing machine needs new bearings. I got a car that needs a brake job, so my 9 and 7-year-old will be doing that very shortly. I had a friend come over last week and we did brakes on his truck and made his kids take a look at it. Stuff to try to enrich them, teach them how to use, implements of destruction like saws and drills. I'll sometimes just take a board and give them nails and say, hit it with a hammer, don't poke your eye out, with supervision. But it's just stuff that I am trying to separate completely from work and remember that I've got to be a great dad because I'm responsible for all the other things outside of work as well.
I love that. Now we have a great question from Kimberly Ann, and she asks, how many patients do you see, especially when you're not working with nursing support? What does that number look like?
Yeah, so Mayo Clinic had a big push a few years ago to eliminate as many return visits as humanly possible to try to find new patients that would be more appropriate for surgery. We have so many people that travel here. So the vast majority of my appointments are news. So like today it was 8 news in a row from 8 to noon. And then in the afternoon, there's fewer slots, but I did a procedure clinic this afternoon. So I had 5 procedures in the afternoon and I had 8 news in the morning. Sometimes you get 11:30, that's like a return visit. They need a listing, or if it's a follow-up, if someone's got an expired Trimix prescription. But usually I'm not seeing more than a couple returns, and a lot of our patients are news because so many people travel here because they've seen other people and they're looking for a different option or looking for surgery or they're really complex or something. So I'd say quantitatively, I see less patients than a lot of my colleagues, but I'm seeing probably a high proportion of new patients and ones that kind of you need a shovel to dig through some of their histories. They take a little longer. So I think that's what leads to the difference in the numbers. So.
Wow. Yeah, you're definitely busy. Elise, round us out, girl.
All right. So my day actually starts at 5 a.m. I get up and I actually walk 4 houses down the street to my mom's house, and we do a variety of exercise, whether it's kickboxing combat or we're pumping it out with some weights. So I do that most mornings. I'm back around 6 o'clock. I'm getting myself ready. I'm usually done around 6:30. I'm getting the girls breakfast. They're usually up. They've kind of started hearing me kind of move around. So they're usually up and, we're spending some time together. They get breakfast ready. My mom actually retired last year, so she's actually our caregiver. So she comes over around 7 to kind of take over my spot as my husband's getting ready. He usually leaves around 7:30. I have about a 35-minute commute to my office. So I'm just like Basil, right? Like listen to podcasts, making the most out of it. Some days I'm fried and I'm turning up Cardi B's WAP on the way to work and we're jamming. Like sometimes that's what you need. And so like, that's we're going to go for it. I'm drinking my coffee usually, and then I get to the office at about 7:35, 7:40. Sometimes I'm the first one there. Sometimes my staff is already there. I'm going ahead and looking at like any of my inboxes, any labs that have come back from the previous day. So I'm checking on those, sending them to my MA so that she can do the follow-up and call for that. I'm usually kind of eating breakfast at that point. I usually start seeing patients around 8 o'clock. I probably see anywhere now we're still not full, again, just because I've opened and I have the luxury of seeing my new patients for a whole hour. My returns are for 30 minutes usually. Procedures are 30 minutes to an hour, just depends on what we're doing. I have kind of a hodgepodge too, right? It's, a mix of new patients, follow-ups, procedures. I'm doing cystos. I do penile Dopplers, clitoral Dopplers, bladder Botox, trigger point injections in the pelvic floor. So again, it's just a variety of things that we could be doing. I do a mix of gynecology too. So sometimes I get that nice like well woman exam that I don't really have to think too much about, which is so nice. So we've got kind of that. I've got lunch. My pelvic PT and I actually share an office and we share a lot of mutual patients. So we sometimes get stuck consulting on cases and talking about things during the lunchtime. I'm grabbing something quick to eat, catching up on charts and my charting, and then I've got patients usually till about 5 o'clock. We do see patients on Tuesdays till 7, and I do first assist in the OR on Tuesday mornings. And so then I'm usually done at the office, maybe 5:15, headed home. Obviously there's traffic, so it takes me about 45 minutes to get home. Usually my mom, who's my rock star right now, has supper ready. So we've planned out what we need because my husband doesn't usually get home till 5:30 either. So by 6 o'clock, we're all sitting down to eat dinner. And it's really important for all of us to sit down as a family. So we try to do that almost every day. And then we're doing baths or reading, or we're having dance parties at the house, singing out to Frozen. Oh my gosh, that song has played so many times at our house. And then usually the girls are in bed around 7:30. And I actually lay down with each of the girls at bedtime and kind of just chat with them and have just that one-on-one time because I know it's so precious. Just like Stephen said, we don't get a chance to really spend that time with them. And they love it. It's so funny. I've forgotten a couple of times to lay down and they're like, Mom, you need to lay down with us. So I get that they love that time. I really enjoy it too. It's just shutting things off too, right? It's being present, it's being in the moment. That usually is my de-stressor. So by the time I hang out with them, it's 8 o'clock. I talk to my husband for maybe 20, 30 minutes and like, how was your day and what's going on? And, what are the plans for the next day? And then I'm catching up on emails because that's a ridiculous amount that I get every day also. And then usually I'm trying to be in bed between 9:30 and 10 o'clock. So, and then like everybody else, we just do it all over again.
Wow. Well, our 1 hour session is up and I feel very sad, but I feel inspired and I'm inspired. I'm optimistic about the future of urology. Hearing, what each of your typical days look like and the passion and initiative that you've taken to get to where you are. I don't know that I've ever been so hopeful just for the future of urology and sexual health and men's health. So, we all appreciate each of you sharing your stories tonight and your lives with us. And we hope that, the people who join us tonight hop on to future webinars. SMSNA, Endo Pharmaceuticals, Boston Scientific, they are changing the way that they're engaging with advanced practice providers. And the initiatives like this and others that are going to be the day before SMSNA and other events going on, now is the time where you don't even necessarily need to go to a conference, but industry is looking at what's going on and they are putting money and resources to your education. And I think, with just over the next year, the next 5 years, the stuff that each of you get to do in the office, I think it's going to be very different than what it is now. And you'll have the opportunity when you interview at places. And if you want to take on more autonomy, you'll be able to say, I want to do XIAFLEX, and I know more about XIAFLEX than anyone that's currently on your faculty. So how are we going to make this happen? I want to do vasectomies, and I've already done 10. So how are we going to make this happen? And so just look out for all those opportunities coming your way. So we'll wrap it up there. Y'all have a great night. And thanks for spending your time with us this evening.
Thank you, Amy.
Thank you so much.
Thank you, team.